Now, obviously, everyone knows that, if you are in a secluded room and you're there with only one other person, and if they're making you unconscious when you're not supposed to be made unconscious, they're doing it to commit a sex assault. So, and I really, have some other information also. I think other people came in at that time as well. So, well, the test on February 15, 2013, it started at 105, and he was rolling, and then he claimed that the injection didn't work, but actually the injection worked. See, what happened is he did the injection after sequence number 8, and sequence number 9, the information shows, was just fine. So he did the injection, the contrast went up, and he got the images for sequence number 9. Then after sequence number 9, that's when he lied to me, and he told me there was some problem with the injection, and he ended up jerry-rigging that catheter to my hand. And then after spending about 10-12 minutes doing that, he stuck me back, he got me back into the tube, and let's see, we're up to sequence number 9, so he did sequence number 10. So obviously everything was okay, so he did sequence number 10. And then, after doing sequence number 10, he got me out of the tube again, and he actually inserted an extension line, and I had no idea what's going on. So he inserted an extension line, and then he did sequence number 11, which is the last sequence. So he did sequence number 11, and then I know what he did. Then he flushed the water through the ulnar artery. Now there's two arteries in the hand. The radial artery is where you usually check for your pulse, and this is the ulnar artery. It's the other artery which no one usually checks much. But anyway, so that's where he flushed it through, and then the electronic evidence shows, and I was able to get not just the CD from not just the data recording from the MRI, but it also transferred over to Microsoft WordPad, which is like an extra program that comes out of Microsoft Office, I guess. And so when he made the CD, that same evidence shows up, and it shows basically that I was there. The test started at 105, and I really got out like at 2:57, and at that time I didn't pay attention to the clock. I wasn't sure what's going on, so I had no idea that I was actually there for an extra hour. And so anyway, so that's what he did. So and he knowing, so what happens is when you flush water up the ulnar artery, half of it goes up to the brain, and so when I did and the other half goes to the heart. And what happens to the heart is, since it's going up the artery, it's going up in reverse, so it pummels the artery, it pummels the heart from the heart's exit. So where the heart is, where the blood exits the heart, so now you have this large, amount of water going up, and then at the same time, the other half went up to the brain, and when that comes back by the normal mechanism with the veins, that's coming to the usual, the input part of the heart, right? And so basically, you have the heart being pummeled from both sides. So obviously I get heart injuries, and then I had a CT done before one time, and so I repeated that CT, and what I found out is I had some minor calcifications in my brain, and those minor calcifications were all dislodged, and some of those calcifications were deposited in my left ear and some of them in my lower back. And then what happened was also, I guess there was like this landslide basically coming down from my brain down to my heart, and it couldn't get into my heart, and I developed all kinds of extra veins on top of my chest, because when you have this extra fluid coming down, if it cannot hold it, because everyone kind of has some really small veins inside their upper chest, but you can't see them like you can see on your arms, you know. So if I guess if you're not like fat, and usually if you're like well built, you can see all your veins on your arms, right? But you know, you don't really, unless you're like a really low fat bodybuilder kind of person, you don't really get veins popping up on your chest. But I got veins popping up on my chest, and that's called collateral circulation. So I basically got injuries in my brain. I got injuries in the parts coming down from the brain to the heart. Then I got injuries in my heart. I got injuries in my arm, in that artery. But incredibly, the body actually compensated really well. And all I really noticed is my old symptoms kind of got a little bad, you know. So the old numbness and dizziness in my head kind of got a little bad. And I think even though my symptoms got bad and I had this really bad condition in me, I still think, you know, my condition was at that point stable, and I don't think my life was going to be shortened in any way by that. But then what happened is, I went back to Dr. Kulkarni, my neurologist who ordered the test. I went back to her a month later. And when I went back to her, obviously the conspiracy was already in place. So, you know, I didn't really know all what happened. I just knew that the MRI tech told me that the veins shut off. You know, obviously that was a lie. The vein never shut off, and he was just going after my artery. And I also told her that you know, when right before I left the MRI test, the MRI tech was actually checking. I knew that, which he was checking. He was showing me fingers. He wanted me to let him know how many fingers I see, and also he was trying to get me to answer incomplete sentences. Now, you know, I'm not really that familiar with the medical stuff. You know, I basically didn't get any kind of treatment for like years and years and years. So, but I kind of knew that kind of stuff is kind of over the top. You know, that's kind of, you know, when you have like a head injury or something, or you have a stroke or something, they kind of check, you know, kind of if your brain is still functioning normally. So I was kind of surprised by that kind of thing. But I told her all that. But obviously, what happened is, the conspiracy was already in place, because now that fraudulent kind of operation, that Capital Imaging, is actually owned by a neurologist, like as I said, and that's a neurologist in Bethesda, and I think his name is Dr. Jeff Jacobson. So Dr. Jeff Jacobson, and it looks like he has a colleague in just the other side of the river in Fairfax, and they both basically have kind of like the same background. They've been, you know, they're like neurologists who've been practicing in the DC area for a long time. And this other neurologist is Dr. John Cochran at Innova, and he's the head of the practice where Dr. Kulkarni practices. Now, even though he's the head of the practice, he's not supposed to be in any way involved in my care, and even the practice or Innova really has nothing to do with my care, because the way medical care works is the relationship is between the doctor and the patient, And you know how it is. The medical license is issued to a doctor. The medical license is not issued to a doctor's office practice or like a large giant monopoly healthcare system like Innova. I mean, I guess they can run hospitals, but you know, it's really supposed to be something between me and my doctor. But it looks like the conspiracy was already in place, and so Dr. Kulkarni came ready to suppress everything that I said, and she actually went overboard. In suppressing it, because I only told her minimal stuff, because that's all I knew. I said what I thought happened, and which I had no idea that any kind of unconsciousness or sex assault or anything happened. What I said is, I had the problem with the vein, he had the problem with the vein, and then he was doing the strain kind of testing at the end, checking my, showing the fingers and stuff to see if I can see how many fingers is showing up, showing and stuff, and also the other thing was I had two small swellings under my eyes, and actually and so that's all I had noticed at that time. So I didn't, and that could have been like a usual reaction to the test, but Dr. Kulkarni knew exactly what was going on, and of course I didn't know exactly what she was doing there, but so she told me that, oh, you probably misunderstood. That was like a harsh kind of line. You probably misunderstood, because I really didn't accuse or even think anything really bad happened. And I even said that I don't think the guy did anything wrong. And to have such a strong response, and then she was actually squirming all around the room. So she would kind of squirm, she would kind of like run away from me to the other end of the office, then come back closer, then she would make like a slurping noise with her mouth, like so obviously she was a nervous wreck. And so so she couldn't do, because really what she was going to be doing is she was going to be concealing a sex assault. And that's an aggravated sex assault. It's a first-degree sex assault. I mean, if you're going to injure someone just to commit sex assault and you're going to make them unconscious, that's the first-degree sex assault. That's a very serious crime. And she's aiding and abetting, which after the fact that may be, but still that's a very serious crime. And she could actually get 15-20 years in jail for that. So she's involved in that kind of a crime, and that's why she's acting so nervous. And so she starts to conceal, but incredibly what she does is the only kind of testing she does is to find out if those things really happen. Now obviously you can't see the sex assault at that time or any evidence of it, but what she did is, in the middle of her squirming, she got really quiet and she checked my ulnar artery in my left arm for a pulse. And that's not part of any kind of routine medical test. If at all you check for a pulse, you check just for the radial artery pulse. And she also did a very thorough fundoscopic exam, which is the eye exam, and you look from the eye from the outside, and you can actually see part of the brain, which is actually the optic nerve, and you can see the arteries and the veins. So you can kind of see what's going on with the brain just by looking at that part of the eye. So she looked very thoroughly at those parts, and she was clearly looking for a brain injury. And